Good afternoon. My name is Gisela Chelimsky. My capstone project for the Kern Institute Teaching Academy was an introductory course for the medical students in their third year regarding the impact of racism and microaggressions on healthcare. My mentor was Heather Todd. Although cultural competences are very important in the development and growth of students and residents, and as part of their evaluations, there is minimal teaching on the impact of health disparities on the medical care, as well as the subtle aggressive interactions that patients may have with us or we may have with patients, as well as our interactions in daily life, as well as in medical practice. There are few studies that have looked at the interventions to decrease bias against mental disorders, disability, substance use disorder, biobehavioral models, sexual orientation, and racial health disparities. And there are even less studies looking at the impact of teaching modalities on improving cultural competencies. Therefore, this M3 curriculum aimed at increasing the awareness of structural racism, socioeconomic determinants of health, and microaggressions in healthcare. The methods to develop this curriculum included key stakeholders, including the M3 students and pediatric clerkship, the clerkship directors, the Office of Diversity and Inclusion, and my mentor, Kern Kennedy classmates and instructors that gave us feedback throughout the process. The model of instruction includes experiential, situated, and transformative. The process to develop this curriculum included review of the available literature and assessment of methodologies, discussion with mentor and key stakeholders regarding the key concept to present, the length of the curriculum, and the delivery mode. I reflected also on which specific characters I wanted the medical students to develop through this process. I developed the curriculum online for the students to review at their own pace during the pediatric clerkship rotation, as well as a post-test questionnaire and journaling. This curriculum addresses two main concepts. The first concept is structural racism and socioeconomic health determinants. It defines racism, the understanding of the socioeconomic health determinants. It also incorporates a TED Talk by David Williams entitled "How Racism Makes Us Sick." The students are also asked to do some reflective journaling on their experience regarding structural vulnerability, racism, and health. The second topic addressed in this curriculum is microaggressions. The curriculum defines microaggression, gives examples, and also explores the impact of microaggressions on human beings. Microaggressions produce exclusion. The curriculum also presents a TED Talk by Tiffany Alvoyd entitled "Eliminating Microaggression, the Next Level of Inclusion," and also asks students to do some reflective journaling. We also explore the consequences of microaggressions in the workplace, mainly the role of women in microaggressions in medicine. The curriculum asks the students also to reflect on why I don't see color as a microaggression. The impact of the curriculum is evaluated through the reflective journaling as well as the post-course assessment. In conclusion, the development of this curriculum created a novel collaboration. New concepts also emerged from this study. For example, the links between microaggression and the socioeconomic determinants of health. Students have not yet trialed this curriculum, so the next step is feedback from the curriculum trial and 2 rotations during the pediatric clerkship. Changes will be made based on the feedback. The next step is to assess if this curriculum should be expanded, either by adding more units for M3 students, adding units in the different years during the medical school, incorporate this curriculum into residency, and disseminate also, perhaps to faculty and staff. This curriculum, if implemented, may increase the curiosity of our students regarding racism, microaggressions, and its effect on personal and structural health. My aim in developing this curriculum was to create curiosity. MCW still has many issues with institutional racism and inclusion. How can we change these problems to create a better working place? Perhaps we can start with the students. How can we empower our students to challenge the role of racism and microaggressions in health, which includes how we treat patients, but also how we treat each other? I also wanted to create connections. Obviously, at the center are the students. But we also included the clerkship directors in the pediatric clerkship, the Office of Diversity and Inclusion, and the residents in pediatric, who already have asked me to look at this curriculum. I would like in the future to bring this curriculum to the Pediatric Diversity and Inclusion Council, perhaps to the residency directors, and eventually to the chair of pediatrics. We want to create value. We want to get the students that are exposed to the concept of racism, health disparity, structural vulnerability, and microaggressions to develop curiosity and awareness of these factors and how they affect health. That would hopefully increase their empathy, bravery, courage, humility, and compassion. Strength lies in differences, not in similarities. Thank you so much.